We are happy to tell you and illustrated you some of the good activity we are doing on Puberphonia. We just finished the 379th case of Puberphonia with good results. On the first day itself, by pharyngeal resonance manipulation, the boy got the good voice. We are giving training for 3 days in Siva ENT hospital. It is combined with virtual reality also, and they will have a confident voice forever. Now we have formed a strategy, a good rapport with the Puberphonia treated boys. They will be followed up for 3 days. We are following in Siva ENT hospital. At the 1 week interval, we are giving a ring 1 month, 6 months, and we have planned to call them and follow for 5 years. There are various possibilities we are bringing out to the society because Puberphonia treatment is imagination. You feel it is a very simple process only. But this is a social lift we are giving for the patient. So, what are the psychological aspects before undergoing therapy? And after therapy, we are measuring the psychological factor for these boys. We are bringing out a new thing to the society. The Puberphonia boys are coming mostly the range of 18 to 25 years. And our next step is up to 35 years. After that, rarely they come. Here, the important thing I want to inform the society that 30 to 35 years of boys who are unmarried, they got married immediately after the treatment. We are so happy. Their life is changed. Many boys, without the proper recognition in the post, they got it. They got the recognition. So this gives us more strength and so many things we can tell. I never want to tell you here the problems of Puberphonia boys. No, they are great. They are having all capability. A society with Puberphonia, we can make it. So all boys should come and take treatment immediately. Whatever the age may be, they will be cured and their life will flourish like anything. Definitely, this inspiration of Puberphonia treatment came to me because of reading Tolhapiam. That is a great thing. With modern theory of Bernoulli's phenomenon for voice production, we are happy to inform you we are going to attend the World Tamil Conference at Chicago. My great guide, Dr. Rajaram, ex Secretary for Government, also participating. I pray that he should participate. He is having lot of work even now after retiring from government service. He had done some novel ideas to spread the message of Tamilians throughout the world. He is doing it. He do the dance drama throughout the world. குறள் அமுது ஆயிரத்தில் ஒருவன். குறள் அமுது ஆயிரத்தில் ஒருவன். A good Tirukkural dance drama. He should exhibit it in Chicago World Tamil Conference. Definitely he is already invited, but he is having a lot of work. Still I am pursuing him. You have to do it. It is your great strength. You should popularize this ஆயிரத்தில் ஒருவன் குறள் அமுது throughout the world. My great Jain philosopher, and always he is helping me in all respects. I have introduced this Puberphonia only through him. He only opened my department of virtual reality at Siva ENT Hospital. He had attended mostly my 27 years Maruthua Rivial Manadu. So now we are going to face the citizens of the world, Tamil population at Chicago in the month of July from 3rd to 7th. So it is a great occasion. I only want to meet most of the Tamil population, the core Tamil population which is behind the research. Definitely I'll pay all my respect to Pullavar Francis Muthu and Arularar. He is almost a arasar to us. So both people are striving very hard to organize the World 10th Tamil Conference at America level. No doubt, FETNA President Mr. Sundar Kupusamy is the man behind all the show. So we'll have definitely a friendly relation with all the Tamil scholars throughout the world. I am now also excited to see the Tamil genius from England, Dr. Ronald. More than that, from Russia, Dr. Alexander Dubansky is coming to the World Conference. From Pennsylvania, Vasu Ranganathan is coming. And from Africa, Marud Nayagam is coming. So we will have a great opportunity to meet these people. And my inspiration of voice care, teaching of Puberphonia, treating Puberphonia, I have got the inspiration from Tolhapiam. That I want to demonstrate. My friend Dr. Nagarajan now told me, why not you present a poster also there? That will be visible throughout the conference. Many people who are not able to attend my lectures there, they have a good idea to see the poster and they may communicate to you. And Dr. Nagarajan also advised me to stay a few more days then only they will be able to interact with you. You will get more idea. What is the next step you can take out of the experience in Chicago? Definitely, it gives me more enthusiasm. I remember when I'm a professor in Stanley Medical College, I used to remember telling the students, you should have, you will have a lot of opportunity, but you should take, pick up which is better for you. There is one good instant I used to narrate to the students. It may be looking little funny, but this is the thing. You are going in a plane. The plane is suddenly landed in the desert or in a place there's no other living creatures at all. You are the only person caught in the desert or a mountain. You want to escape. There's no way you are able to locate. There's no road. There's no gate. There's no human being. But you are having some inspiration by God. First, you are frightened. See, you should be, whenever you are there in a place, if you got it, definitely you will be frightened. But when it becomes accustomed, you accept that and try to live in that surrounding happily. So similarly, you have caught in a deserted place. Nobody is there, no human being there, no way to escape. You are in the mountain, thing like that. But you are having some inspiration. You should escape from that place. But there is a message coming from your inner mind. You are smelled in that area. A big animal is going to come there to catch you, and definitely it kill you, because you are a new man, new creature, which is not available already. You had come from a flight. You are in that land. Your smell is recognized by a wild animal which is coming to attack you. This is the message you got. Yes. So what is the remedy? A big animal is so you should want to escape from that. So what is that? Another inspiration comes to you through an angel or a god or a message from the brain, or your neurons are working. You got some energy. You can run. You can think. You can make fire and escape from that place. But another message is coming in that area. You are having 10 hours to escape. If you stay there for 10 hours, you will be killed. But you can escape. The 10 hours is only available. And another message is also there. A direction, a apparatus will be available to you to show the direction. Which direction if you go, a relief will be there. But that also will be far away. But you should reach within 10 hours. Here we are going to give, the angel is going to give two options only. You want a timing machine which will calculate 1, 2, 3 to 10, and when the 12th hour will be over, another machine will show you the direction. If you go in that direction, you can escape. So two options are given, but you have to take only one. One is available for you only. You want the timing machine to show you 1 hour, 2 hour, 3 hours to 10 hour, or which direction if you go, you will have a chance to escape. A boat will be there, or a ship will come, or another flight is there, or another human being to protect you is there. Which you select? This is what I ask my MBBS students. You want the time calculating machine, or you want to know the direction by which if you go, there is a chance for escape. But the direction also, you should finish it within 10 hours. So you need the direction and you need the calculation of the time also. So which you want, tell me. Definitely we'll prefer the direction by which you have to go. Time is not the matter, because we can run. Any direction if you run, if you need not know the timing, but you can run fast, which direction you are going to get the relief means it is a great. So the time machine I never want. I want only the direction by which I want to escape. So similarly, dear Puberphonia boys, we are going to give a good direction to you, that it is up to you to pick up. By doing pharyngeal resonance manipulation, we are going to give you a good voice on the same day itself. You will get the voice, but you need training. Your mirror neurons should be activated. You should make it a lifelong process that comes by doing regularly the practice. It will become a conditioned reflex. But you should come away from the stigma of puberphonia. You should come away from the society which feels you are puberphonic. Even birds, the mother bird help the small one from the egg catching onwards. It protect the bird, but as soon as it is having the capacity for flight, it just push the younger ones outside. That you can see in good birds. So what is there? Until they learn flying, the mother, father, everybody take food from outside and give it to the offsprings, the younger ones. When they are having the capacity to fly, but they also don't know they are having the capacity to fly. But the mother bird know, my child know how to fly. So from the top of the tree, the mother bird, when the child bird know how to fly, that maturity, even the child birds don't know they are able to fly, but the mother know when it can fly. So the mother just pushes the child from the top of the tree outside. What happened to the small child? It fall from the height of the tree downward, 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 downward. But in certain height, it want to escape from falling down. It tries its wing to fly. It little balance. When it little balance, it is not coming down so heavily. Slowly recognized its flies are there, its wings are there to fly. It attempts, it attempts. When it reaches the ground level, it tries to fly and go back to the height, even to the top of the tree. So our duty as a doctor and therapist for puberphonia, we give the energy. How you get the normal voice? By pharyngeal resonance manipulation. You get the voice, then up to you, you have to try and fly, fly, fly. Then you will reach whatever you want. With great hope, we have reached 379th case of puberphonia manipulation treatment today. No surgery, no medicine. We just manipulate the pharyngeal resonance. The resonance mechanism, we change it. The resonance changing mechanism we learned when we read the physics. The resonance of your voice can be changed. Even Nadaswaram, when they try to manipulate to have a good record voice, they change the resonance. So we found out a great, with great inspiration, we got the idea that resonance manipulation will treat the puberphonia. By this method, we are breaking The old idea, puberphonia, the reason may be there in the larynx. We are so confident to say we are not doing anything on the larynx. The basic treatment of puberphonia all over the world, the surgical treatment all over the world, they are doing definitely with miracle, good hand by few surgeons. Puberphonia is all right by doing surgery on the vocal cord, but it's having its own risk. In a textbook also it is suggested the surgical treatment should be taken when all other treatment fail. That's all. It is not a first option for puberphonia. Don't go for surgery. It's a first instance. Try all the methods. Puberphonia boys are also trying many methods. There are more than 10 exercises for puberphonia. Definitely they will get it. The olden, their own male voice. But we have found out a technique by which within a minute they will get their voice, and you have to maintain it by a pharyngeal resonance manipulation by putting a small thread on the air passage. This theory I want to prove it work well by a few experimental. For that only we are trying very hard to make pre-operative and post-operative animation of the air space in the pharynx, air space in the larynx, air space in the nose, and the animation of what are the things happening in the vocal cord. 2 days back, a patient came with false vocal cord which causes puberphonia. In that case, this is called dysphonia plica ventricularis. That means before vocal cord meets together and make sound, the false vocal cords meet together and make sound. Definitely, the previous few surgeons diagnosed as dysphonia plica ventricularis, and they did good surgeries also in the vocal cord. They had given in even protobase injection to the vocal cord, but they are not able to. That time, that trial, the good ENT surgeon not able to treat. That time it was not successful. So the patient is not relieved. He came to me and we have made it all right. My feeling is dysphonia plica ventricular is not the cause for puberphonia. Because of puberphonia, this puberphonia boy tried, and he made the voice more worse by creating his larynx as dysphonia plica ventricularis. So originally, it need not be a dysphonia plica ventricularis. It is a puberphonia. Later, it developed into a case of false vocal cord meeting together before the true vocal cords. Another case, very interesting for me. infantile epiglottis. This is very common thing we will see in laryngomalacia. The infant larynx, if you see the epiglottis, infantile, it is a omega shaped epiglottis will be there. That can be a cause for puberphonia. That time, that ENT doctor presumed. But infantile epiglottis, until that patient reached to me with puberphonia, still it is there. It is not developed at all. So, general tendency by as ENT surgeon, this infantile epiglottis may be the reason for puberphonia. But we have done no surgery on the larynx or infantile epiglottis. We treated that puberphonia by pharyngeal resonance manipulation. So these are not the